The continuous infusion administration method combines 1.3 milliliters activated DEFINITY in a 50 milliliter preservative-free saline bag. This method offers a consistent and steady enhancement of DEFINITY and is well suited for exams which are performed over an extended period of time. Following activation with vial mix, continuous infusion dosing can be prepared with using either PinSync vented vial adapter 13 mm or 18 to 20 gauge unfiltered needles. Supplies needed include a 50 milliliter bag of preservative-free saline, 3 milliliter syringe, and 18 or 20 gauge unfiltered needles. Following activation with vial mix, remove the cap from the DEFINITY vial. Vent vial with a needle by placing the needle tip in the activated DEFINITY vial. When using a needle, it is important to vent the vial. Venting avoids negative pressure in the vial, which allows for easier withdrawal and prevents microbubble disruption. To withdraw activated DEFINITY, take a 3 milliliter syringe and attach an 18 or 20 gauge unfiltered needle. Insert needle into the vial. Do not inject air into the vial. Invert the DEFINITY vial and ensure the needle tip is positioned approximately in the middle of the suspension. Slowly withdraw 1.3 milliliters activated DEFINITY. Add the 1.3 milliliters activated DEFINITY into the 50 milliliter preservative-free saline bag. Gently squeeze the bag to evenly distribute the microbubbles. Titrate drip rate at 4.0 milliliters per minute. The flow rate may be adjusted with a maximum of 10 milliliters per minute for optimal image enhancement. Let's review the important safety information for DEFINITY. DEFINITY Vial 4 Perflutrin Lipid Microsphere Injectable Suspension. Indications: activated DEFINITY Perflutrin Lipid Microsphere Injectable Suspension is indicated for use in patients with suboptimal echocardiograms to opacify the left ventricular chamber and to improve the delineation of the left ventricular endocardial border. Contraindications: do not administer DEFINITY to patients with known or suspected hypersensitivity to perflutrin lipid microsphere or its components, such as polyethylene glycol, PEG. Important safety information. Warning: serious cardiopulmonary reactions. Serious cardiopulmonary reactions, including fatalities, have occurred uncommonly during or following perflutrin-containing microsphere administration. See Warnings and Precautions 5.1. Most serious reactions occur within 30 minutes of administration. Assess all patients for the presence of any condition that precludes DEFINITY administration. See Contraindications 4. Always have resuscitation equipment and trained personnel readily available. In post-marketing use, rare but serious cardiopulmonary or hypersensitivity reactions have been reported during or shortly following perflutrin and PEG-containing microsphere administration. See Adverse Reactions 6. The risk for these reactions may be increased among patients with unstable cardiopulmonary conditions and/or with pre-existing PEG hypersensitivity. See Adverse Reactions 6.2. It is not always possible to reliably establish a causal relationship to drug exposure due to the presence of underlying conditions. Please see full prescribing information, including boxed warning, regarding serious cardiopulmonary reactions. Full prescribing information is available at DefinityImaging.com from a Lantheus sales representative or by contacting Lantheus customer service at 1-800-299-3431.